The clock is ticking toward the March 31st deadline to sign up for coverage on the New Mexico Health Insurance Exchange. Although President Obama just issued a list of situations where people can get waivers to complete that process. But while thousands of low-income residents have enrolled under Medicaid under the expanded eligibility guidelines, the numbers for those buying individual plans in New Mexico continue to lag. Only about 15,000 have purchased plans. Sounds pretty good, but that's far less than the goal of 50,000 that officials had hoped for. Rob, you wrote about this recently. It sounds like a good thing that we have so many more people with coverage if you count Medicaid and it together. But there was a problem, however, with the 15,000 number, isn't there?
Well, yeah. I mean, originally they wanted to sign up 80,000, but then,
right.
It should be pointed out that if you want to get individual coverage through the Affordable Care Act, Obamacare, here in New Mexico, you have to go through the federal site. Now, if you want to have your business covered, then you can go through the New Mexico Health Insurance Exchange site, which has not had all the problems that the federal site has
We haven't heard it, so it must be
right. So, but as far as the Medicaid versus Medicaid roll-ups in enrollments, it's compared to the ACA individual care enrollments. 15,000 people have signed up on the individual plans, 103,000 on the Medicaid plans. Why? That's pretty much something to be discussed. I think one of the big reasons why is because if you apply and get accepted to Medicaid, it's free. There are no premiums there. If you want to sign up for an individual plan, even if you qualify for a lot of subsidies, you have to pay. I think that there are a lot of people who maybe make a little bit more money, so they're not on Medicaid, are making a decision. They're saying, if I don't sign up for this individual coverage, I pay $95. And I'd rather pay the $95
that would be
than pay a monthly
That's
premium,
right.
even if it's
And in fact, they found that in
subsidized.
Massachusetts when they went. A lot of folks decided to just pay the fine, and they had to redo this. You know, Richard, it's interesting to hear Rob talk about this because, again, you know, maybe we shouldn't be surprised so many folks have chosen Medicaid here. I see on Facebook and all over people getting, honestly, sticker shock at what they're getting from the quotes. If you're a server, suddenly 180 or 200 bucks a month is a big deal. And it's a lot of money. Even 150 is a big deal. And so it's a difficulty. Should we be surprised so many folks are going towards the Medicaid direction? And if so, what's the harm?
I don't think so. It's just, I think we have a problem that it's just too expensive really for a lot, particularly the young people.
Yeah.
I think. And we need the young people in this. That was part of the whole idea at the very beginning, that they were going to cover the other people, but it's just too expensive. They can't really afford it.
In your mind,
I'm not surprised.
What can the administration do to hasten that? They've done a couple of things, you know, doing guest things with, you know, celebrities and such. Is there anything more anyone can do to convince a young person to sign up at this point? That's my question, Ed.
I sure don't have a ready answer for that, really, other than they're trying a lot of somewhat hokey things, but
That's right. Hokey or not, Lord, I mean, some work, some don't, but we need to have something happen here. What's your sense of what needs to happen before the 31st here?
Well, I think, you know, I think Rob is correct about people doing a cost-benefit analysis for themselves and paying, you know, $200 a month for the next year or whatever versus a $95 fine at the end of the year seems, I mean, it's a no-brainer for a lot of people that are living, you know, hand to mouth in this economy. I think for young people, it's the same thing. I mean, they're young, they're healthy, they don't necessarily have many medical needs at all. So for them to have to justify, you know, $400 a month, which is something one of my colleagues, somebody I know, was facing under the individual plans. I mean, that's just insane in an economy like this. Plus, if you there's a segment of the population that is now out of undergrad or out of grad school, let's say, has considerable debt that they're dealing with. There's no way out of paying for some of that student debt, and now you add on to that a $200 to $400 a month payment. It just becomes unmanageable when we pay such low wages here in New Mexico. So I don't know what the solution is immediately, but I'm not surprised. One thing I do want to say is I don't think it's an option that people are going to Medicaid versus the individual plan. What's happening is, you know, oftentimes they go to UNMH, they go to other places if they're uninsured, and somebody does their intake and then basically says you're eligible for Medicaid and then directs them, you know, to take that route because they're eligible. They don't exactly, you know, get to the point where they're choosing Medicaid. I think, or Medicare. They're basically looking at, you know, what's available to them, and why wouldn't they
That makes
take,
sense. That makes
you know,
sense.
the free option?
Yeah, that makes sense. You know, on that note, Diane, it's interesting. Thank goodness our governor decided to accept.
Yes.
Could you imagine where we'd be without it? I mean, we'd be like in a bigger bind. But again, your sense, what's the downside if so many folks choose to not, beyond what's obvious, premiums are not going to come down if we don't get a lot of people in the exchange, but you can't expect people who have the Medicaid option to go there if they don't have to. Are we in a bind here because of that?
We very much are, and to oversimplify things is think in terms of auto insurance. People will get it and then drop it, I mean, long enough to get a loan or whatever and and then they drop it, and then they have an accident, but they're willing to take the risk.
Right.
The risk is not so bad, as we were just saying. The penalty is less than $100. And I haven't seen anybody that can get a premium for a monthly $100.
That's right.
I think the other thing, too, that might be a contributing factor to this is that the president has delayed so many regulations in this that I think that, you know, maybe a young person who's not following the news that much, they kind of just, through osmosis, they're getting a general idea, and they're thinking, well, yeah, didn't that get delayed or whatever? So I think by all these delays, the president has lost a sense of urgency among people.
Richard, what do you think? What do we need to do to get this thing moving? If you ruled the world,
Okay.
what would you think? Door to door, and everybody that's under 25 in America? How do we do this?
How are we going to get them to sign up?
Yeah.
I don't have a ready solution, really.
Yeah.
I don't think there really is one. With these delays, with the exemptions, so many groups are exempted now. I think it's a real problem. I don't really have an answer.
Yeah.
I'm very candid.
It's a tough one. You know, Laura, I went earlier this month to, I think it's the New Mexico Primary Care Association, their offices. They have these brilliant women up there that will help you. They're brilliant. They will absolutely take you right through the process. It was easy as pie. It was no sweat, but I have to confess, a couple of them talking afterwards were like, you know, it gets hard when you have reactions to $400 a month premiums that people weren't counting on. And having to be across the desk and listen to this, it was a real, I had not expected that, Diane. I didn't realize this was going to be such a problem, these high premiums.
It is, and I think that goes back to not only the premiums difference between Medicaid and the exchange, but it's so much easier. Hospitals have been working on pre-navigation or navigation and diversion programs for years now here in New Mexico. You have someone, a couple questions, you
right.
qualify.
That's right.
Right.
They help you, it's done,
And
slam
it's
dunk.
built into
Right.
the need for healthcare as people
And you
come
try
in.
to go,
right. That's right.
and
So,
they
yeah.
don't have to make decisions. Whereas choosing an insurance plan, they have to go, do I want silver? Do I
That's
want
right.
gold? Do
That's
I
right.
want, what the heck does that
And
all
there's just
mean?
so much
Yeah.
misinformation and a lack of information out there. I think
That's
most
right.
people, unless they're faced with an immediate health need,
That's right.
they just can't even contextualize how much, you know.
I think you've hit it right there.
premium
That's exactly
means,
right.
right.
Until it's staring you in the face.
Right, until you're
it's just a
seeing-
theory. That's right.
Right,
It's
and I think
difficult.
that's really young. I mean, it's the same reason why young people don't vote. They just don't have that sense of urgency, right? And I think there's just also, in general, a problem with putting so much of the solvency of any program. And I would say the same with the Social Security system, you know, with retirement systems, where we have much of the solvency based on the younger population. And that means that they then don't have, you know, the same kinds of benefits as they grow older.
That's right.
And I think that's a real problem that we've got in general.
People can see, they can look down the road and see that. It's a difficult one.
Demography is destiny in many ways.
It really is. The science is pretty clear. So coming up, lawmakers are balking at new procedures from the governor's office on getting information from state agencies.